Do you frequently feel like your heart hurts sometimes, even when the doctor says your heart is fine? Or maybe you've been unusually sad, anxious, or angry after your parents divorced, you lost a job, or moved to a new city. These feelings are normal at first, but what if they just don't go away and start messing up your daily life, like skipping school, yelling at friends, or not sleeping? That could be an adjustment disorder. It's not a serious mental illness like schizophrenia, but it's also more than just being sad. It's your mind's way of struggling to cope with a tough change or stress. Imagine your brain is like a phone. When too many apps open at once, it freezes. Adjustment disorder is kind of like that, too much stress, and your emotions crash. So what causes adjustment disorder? It's not one thing. It's your reaction to a big life change or stress. For example, think about a student named Rhea. Her family moved to a new city. New school, no friends, different language. Nothing dangerous, but still overwhelming. One day, she starts crying before school, can't focus, and stops eating. The event, moving, wasn't violent or tragic, but it was stressful enough to trigger adjustment disorder. Other common causes include breakup, job loss, serious illness, or even happy events like getting married or having a baby. Yes, even good changes can stress you out. Some people are more likely to get it, like teens, people with past trauma, or those with little support. It's not your fault, it's how your mind handles pressure. How do you know if it's just stress or something more? Here's the clue: if your reaction is bigger than the situation and lasts more than a few weeks, it might be adjustment disorder. For example, your friend Alex failed a math test. Normal stress, crying a little, then studying harder. Adjustment disorder: Alex stops going to school, avoids all friends, feels hopeless, and even thinks life isn't worth living. Symptoms can be emotional, like feeling sad, anxious, or irritable or behavioral, like fighting, skipping work, or drinking too much. Kids might act like they're younger, bedwetting, clinginess. Adults might rage at coworkers. It's not a one-size-fits-all, but the key is the stress happened within 3 months, and your reaction is out of balance with the event. How do doctors tell it's adjustment disorder and not depression or anxiety? They talk to you, that's the main tool. There's no blood test. A doctor or counselor will ask, when did you start feeling this way? What changed in your life? If your symptoms started soon after a stress and go away within 6 months of the stress ending, it's likely adjustment disorder. The good news, it's very treatable. Most people feel better with talk therapy, like sitting with a counselor weekly and saying, "I can't stop crying after my dog died." The therapist helps you understand feelings and build coping tools. For example, deep breathing when anxious, or writing in a journal. In some cases, medicine like short-term anxiety pills help, but therapy is the star. Family support matters too. Just having someone say, "I'm here," can light up your world. Can you stop adjustment disorder before it starts? Not always, but you can build emotional strength, like a mental immune system. Think of it like exercise. If you walk daily, you don't cramp when climbing stairs. Same with stress. Practice coping skills early. Talk about your feelings, keep a routine, get enough sleep. For example, if you know you're changing schools next month, talk to a counselor now. Tell a friend, "I'm scared I won't fit in." Sharing lightens the load. Schools and workplaces can help by creating safe spaces to talk. Parents, check in with your kids. How are you really doing? Not just did you eat. Prevention isn't about avoiding stress. It's about not drowning in it. Recent research shows our brains are more adaptable than we thought, a concept called neuroplasticity. This means with the right help, people recover fast from adjustment disorders. Studies in 2023 found that online therapy apps, like text-based counseling, work well, especially for teens who hate talking on the phone. Another study showed group therapy with peers who faced similar stress, like divorce or bullying, helped people feel less alone. Even schools using mindfulness apps during homeroom reported fewer stress complaints. Scientists are also exploring how genetics play a role. why some people bounce back fast and others struggle. But the big message is hope. Adjustment disorder isn't forever. With care and connection, healing is not just possible, it's common.